And so like the rate of retention for fat? I know people ask this all the time. How much fat actually stays?
So I think I quote 60%. So you have to overgraft. You got to remember that I'm injecting fat, but some other stuff that's not going to stick around. So some of that's fluid because we're not drying the fat out. So there's a little bit of fluid that goes with it. And then some of the fat is just not going to survive. It's a graft, which means it's dependent on where you put it on that surrounding tissue to keep it alive. And if the blood flow isn't strong enough, then it dies. If it's too much, it can die. If it's, I don't know, you smoke a cigarette right after, I guess it could die.
Please don't do that.
Don't do that. So yeah, so there are some factors where some of that is going to get absorbed, and so it's not all going to keep. So we tend to overgraft by like 30 to 40% because we know some of that fat is going to reabsorb.
Right. And the fat, when it just dies, does your body like reabsorb it? I know we sometimes in office put in drains. How does that help with?
Yeah, so we put drains in usually for fat transfers when we're taking implants out, because some of that fat will inevitably leak into just the space between the breast tissue and the pec muscle and under the pec muscle, the space where the implant was essentially. And so fat just like swimming around is not going to graft to anything. And it's just going to sit in the fluid and maybe it gets reabsorbed. But I'm just trying to help your body out by draining whatever fluid accumulates and whatever little particles of fat didn't actually make it into the breast tissue or made it into the breast tissue, but then leaked out into that space. So, yeah, the fat generally is absorbed. If it doesn't get absorbed, it can form fat necrosis, which are like little lumps that you can feel. Again, that fat should break down over time. I tell patients to massage that area. Significant amounts of fat necrosis can form an infection, though. So that's one of the known risks of having a fat transfer and then, having it not all survive.
Well, we want the most fat possible, especially when it's going in the butt.
Yeah. So it's really challenging to try to balance. I want the most fat for that patient. So I'm going to overgraft. But then that tipping point is putting so much in that not all of it survives. And you have run the risk of that complication of having fat necrosis that then creates an infection. And it's not very common, but when it does happen, it's a major drag. And there's, now the fat's spread throughout the breast. It's not like you can just, open up and pull it out. It just ends
Right.
up being a systemic issue. So yeah, and it's, the same thing for a BBL. So Brazilian butt lift, when you put fat into the butt, generally that procedure goes pretty well, but I have friends on the East Coast that inherit some of these cases that were done overseas, like in the Dominican Republic is a popular place to go, or in Miami where they have chop shops where they just crank them out. And again, if that fat gets infected and you have fat now distributed throughout your buttocks, it becomes a huge mess because you can't just, make an incision and get it out necessarily.
Right.